Hi, welcome back to Why Are We Gaming?
You're all insane.
We're about
We're
to...
gonna we're gonna play with somebody's booty hole.
Oh God, no.
I came looking for booty.
This episode's gonna be called Freddy Fazbear.
So, for those of you that watch the Five Nights at Freddy's, this is basically what happens to you when you get capped by Freddy.
Yeah, we know you watched it. There's like 40 views on that one, so we know you're there.
Dirty, dirty girl.
Hello,
Or guy.
and welcome to Surgery
Or
Squad
guy.
Virtual
That's probably Jeff.
Colonoscopy. I'm
Probably
Dr.
Jeff.
Jeff, and I will be
Yeah.
guiding you through this colon today. Also known as the large intestine. The colon is
We're gonna see
responsible
how
for the
deep
final
the rabbit
stages
hole
of digestion.
Oh God.
It absorbs remaining water and electrolytes from indigestible food, accepts and
so
stores
much.
food remains that weren't digested in the small
So-
intestine, and eliminates solid waste from the body. A colonoscopy allows your
Yes,
doctor
yes,
to view
that's what
inside your entire colon
booty does.
using a device called an endoscope. As the scope moves into your colon, your doctor views the output
Oh,
of the
wow.
filter to check for growths or polyps.
What is it?
There are several parts to the
It looks like a
colon.
beehive.
The cecum ascending,
think
the
that was a
transverse, the descending, and the sigmoid. A colonoscopy can check
And then the
each one of
anus.
these areas. The one thing about having a colonoscopy
Oh, God, it's
is that a
sinus.
doctor can find
Cut that out,
polyps and
guys.
remove them immediately. This is the most effective way to prevent the development of colorectal cancer.
Yes,
However, you'll need to
colorectal
cleanse your
cancer.
colon 24 hours before the test by taking laxatives or performing a fleet enema. Also, use of the endoscope might accidentally tear the colon walls and cause bleeding. Plus, you'll need
In
to be
other words,
sedated
they want
during
you to
the
shove a
exam.
garden hose.
which
Oh,
will take
yes.
About 30 minutes or longer if any polyps are found. We have
Yes.
a 53-year-old female waiting for her colonoscopy.
I better
Let the
get
same lady take
sedated.
care of this.
The braces
Our
on.
patient is lying on her left side, knees drawn
She's
up to her
30
stomach.
years old.
She's
and we
wearing a
put
gown,
braces in her
and
mouth.
we have a sheet draped over her.
No, I
Let's
just
set her up with an IV drip of the sedative.
I really hope I get sedated for this one.
No, you're gonna be awake. You're the doctor. You have to be awake. God,
the
her
doctor.
hands
Trust me, I'm the
filthy.
doctor.
Seems like she needs a... Oh, God! It seems like she needs a doctor.
Her husband's gonna be pissed.
Great.
God.
Now
Really,
wait a
Matt?
few minutes for the
What?
sedative
There's
to
a wedding
take
ring
effect.
band right there.
Oh.
Our patient is
Oh.
sedated and ready. She stated that she's cleansed her colon, and I've already used a lubricated gloved finger to check for blockage.
Yes.
Be sure to tell the
Lubricated
patient
gloved
that she
finger,
should
check
breathe
for
slowly through her mouth
Yep.
to relax her stomach muscles if she feels cramping. We'll insert the endoscope into the anus
Don't throw up on
and
us,
slowly
Paul.
move it into the colon.
Professionals.
The endoscope contains a small
Don't throw up on the
camera and
patient.
light.
Turn away, turn
Prepare
away.
forceps so we can remove any polyps we find. First, let's lubricate the scope for easy
You know what? No.
insertion and
No, let's
passage
not
to the
lubricate the
colon.
scope. We're going in dry.
Oh, I love how it says Dr. Jeff's lubricants. Like
Oh, yeah?
he has his own brand of lubricant.
Oh, yeah? And guess what? Guess what? No, we're not using any lubricant.
Carefully insert the scope into the patient's anus and slowly move it into the colon.
Slowly move it. Slowly.
We're going in dry.
Watch the
down.
cameras out
Oh,
to the
yeah.
mouth.
Oh!
We're into the rectum now.
This is like a twisted episode of Magic School
Let's
Bus.
move on into the
You know
sigmoid
what?
colon.
I think I've seen.
Slow and
Isn't
steady.
this what they
You're
use for
doing
the
a
opening
great
sequence
job.
of Doctor Who?
Descending colon's next. Now's a good time to remind our patient to breathe slowly through her mouth as we do the exam.
So Doctor Who
We're getting-
travels through the anus of time.
We're getting particles on our camera.
All right, let's move into the transverse colon.
we gotta just shove it in there.
Looks like we've got a small polyp in the transverse colon.
Oh shit!
We'll use
Get
the
it.
forceps to remove it.
Oh God.
You know,
No. I can never watch the Magic School Bus again.
This gives a new meaning to ass play.
Just grab it.
Doink.
Fine work.
Done.
We'll need to remove the scope
Next.
so we can bring the polyp out. First,
Oh,
let's
God.
use some heat to cauterize the spot and try to stop that bleeding.
I don't want to.
You just reached inside of that person's ass.
Fantastic.
And ripped
Let's
something
slowly
off.
withdraw our scope and get that
I don't
polyp
want
out.
to either. I don't want to do that either.
Let's go back in to
Oh.
check the rest of her
Just drop
colon.
it.
I
Go
can't.
back in.
I can't watch. I just can't watch.
Oh.
Just click it. I'll tell you if you find anything.
Remember the name of the colon where we found the polyp?
Yes,
That's right.
Stacy's.
Transverse colon.
I can't.
So listen to that sound. It's like mixing mac and cheese.
I was just about to make macaroni and cheese too.
Yeah.
I can't.
Oh,
I can't even.
it's squish. It's the squishy.
Who would have thought the anus is triangles? Huh.
It's not pretty.
Just keep going.
Back
Okay.
in the transverse colon now. Everything's looking fine, and you're doing a
Why
great
is this
job.
going so slow? Oh, wait, I forgot I did put lube on it.
Time to remind our
You
patient
can't
to
go
breathe
through
through her
someone's
mouth
anus
slowly.
at the speed of sound,
Moving
okay?
now into the
You're not
descending
Sonic,
colon.
the fucking
And
hedgehog.
there's another one.
Oh, this is the
Let's
wallet.
take it out
Grab
the
it.
same way we did the other.
Okay, he said the same way we did the other. Do 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 do.
Let's grab it. Pop it off. Oh.
Oh, God, no.
Hello, Clarice.
Back in the ascending colon now, and we move into the cecum.
No,
And all
no.
looks good.
Oh, no.
Let's
No.
take out the scope and
Looks
clear
like a
the
carpet.
patient into a recovery room. Our patient
Looked
is
like my
now in
toilet seat
recovery,
cover.
and she'll probably be there 1 to 2 hours. She might feel bloated or need to pass gas. And since we removed 2 polyps, she'll probably have a small amount of blood in her stool. We'll also do a biopsy
sure.
on the polyps. She should call her doctor immediately if she has heavy rectal bleeding, lower abdominal pain, develops a fever, feels dizzy, vomits, or experiences swelling in her abdomen.
Yeah, because that's exactly what you
Well,
want to do
good
as soon
news.
as you leave
The
the doctor's
biopsy showed
office.
our patient's polyps were benign. Since she's in her 50s and there were polyps found, she should have a colonoscopy every
don't-
year.
No.
You did a great
No, she
job.
shouldn't.
today.
Yes.
While you're here,
Have
try your
somebody
hand
play
at
with
one of
her
our other
ass every
surgeries
year.
here at surgerysquad.com.
That seems horrible. That seems like a horrible, horrible thing to do. Yeah, we just stuck a camera up your ass. Well, guess what? Next year, same time.
All I know is Doctor Who is never going to be the same, thanks to my stupid comment.
Okay, we're gonna do one more tonight, and it's not gonna be. It's gonna be on the outside of the body.
It's going to be on the outside of the body.
Yes.
Okay. Did you stop recording, or are we just going to do like one big
Oh,
thing?
whoops, 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 whoops.
Hey, guys.